Hello, I'm Dr. Matt Bridgman. I just wanted to give you a little introduction and background about me. I am a clinical neuropsychologist. What is that? Well, neuropsychology is the study of the relationship between our brain and our behavior. So the relationship between brain and behavior. The brain, we know what that is, and the different parts of the brain specialized for doing different things. And then behavior, human behavior. That involves things like moods and emotions and personality and cognition or thinking skills like memory and attention and thinking speed and things like that. So neuropsychology combines those two, understanding our brain, understanding the different parts of the brain and what they do, and then understanding our behavior, our moods, our emotions, our personality, our thinking, cognitive skills, and thinking life, understanding our mind. And so as a clinical neuropsychologist, I use that knowledge, that understanding of our brain and our behavior to help people who are having trouble with moods and emotions and thinking, memory, concentration, and cognitive skills, and understanding how that might be related to things affecting their brain, things like head injury and concussions and concern for dementia or Alzheimer's, but lots of other things can also affect the health of our brain and our behavior and performance of our brain. Things like multiple sclerosis and strokes and diabetes and lots of other medical conditions. Lots of things can affect how our mind is working. So that's kind of my specialty, is understanding those things, how those health issues can affect our moods and emotions and behavior and thinking, and helping people who are experiencing those kinds of things. How did I get here? So I have a bachelor's degree in psychology, and then after that went to grad school and ended up getting a PhD in clinical psychology. My doctorate, my PhD in psychology, is from Fuller Seminary. Yeah, you heard that right. I went to a seminary and got a PhD in clinical psychology. Fuller is quite unique because they are a seminary and they've got a graduate school of theology where they educate and train pastors. They also have a school of intercultural studies where they educate and train missionaries. But they have a school of psychology as well as a school of marriage and family therapy where they train therapists, they train psychologists. And so I went to the School of Psychology there. Their School of Psychology has been accredited by the APA, the American Psychological Association, for many, many years. And so it meets all of the criteria for a graduate school doctoral level program in psychology, same criteria that other non-religious based universities meet for that good training. But by doing it at Fuller, I was able to also take a lot of classes in theology and spend some time thinking about my Christian faith and theology, and how that informs and interacts and gets integrated with psychology, how psychology and theology can interact and inform each other and how they're related. So after that, or at the very end of let me back up. So during graduate school, though, then I was able to not just get the clinical psychology degree, I was able to tailor it to neuropsychology by taking extra classes, taking classes specific to neuropsychology, and then also getting my clinical trainings in various places that allowed me to get more unique and specialized experience in neuropsychology. And so Fuller is out in California, it's in Pasadena. And so while out there for grad school, I was able to do trainings at some pretty cool places like UCLA and the VA Medical Center in West LA, which were great places. The very last year of graduate school, the sixth year, is a full-time internship where you're doing 100% clinical work. Well, you do get some didactics, some like education classes, but the majority of your time is spent doing clinical work, seeing patients and helping to evaluate and treat patients. And that time I was able to devote most of that year also to neuropsychology, which allowed me to specialize in neuropsychology. And I did that internship at the Togus VA Medical Center in Augusta, Maine. And that was a wonderful year. After that, after graduating and obtaining the PhD, I then went on to do a 2-year fellowship in clinical neuropsychology. So that is after I've completed my doctorate, but before getting formally licensed, you still have to do some additional years of supervised practice and training before you can get licensed. And also specifically for neuropsychology, you have to do 2 years of a fellowship that's specifically at training you in the specialty of neuropsychology. And so after graduating with the doctorate, then I did a 2-year fellowship in clinical neuropsychology at Geisinger Medical Center in Danville, Pennsylvania. And there I got to get a lot of experience working with folks with traumatic brain injury and concussion and dementia, Alzheimer's disease. I also spent time on an inpatient rehab unit helping folks with cognitive and memory and mood trouble after having strokes or other things that required them to be in inpatient rehab. After that, then I was able to become licensed then as a psychologist and get my first job as a clinical neuropsychologist. And I've been working at my local hospital as a neuropsychologist for the past 12 years. At the time I'm doing this video, it's been about 12 years, going on 13. And in the midst of that, then also obtained board certification. And so that's just one other step. So currently the way we get licensed is just you get a license as a psychologist to practice in your state. But that's for all psychologists. And so within the field of psychology, there are a whole lot of different subspecialties like clinical neuropsychology. And so then went the additional step to say, hey, let me go through the main there's two main ones, but the biggest board certifying organization for psychology in the US is the ABPP, American Board of Professional Psychology. And they've got a subspecialty board of clinical neuropsychology, American Board of Clinical Neuropsychology. And so what they do is they say, okay, yep, you're licensed as a psychologist, but we need to have you demonstrate that you have all of the specific knowledge and skills and abilities to be able to call yourself a neuropsychologist and know that you're practicing at the highest level. And you really know what you're talking about when you call yourself a neuropsychologist. So you have to go through some written testing, some evaluation of some work samples, and then some oral exams to demonstrate to neuropsychologists who are kind of the most well-known and the best neuropsychologists in the field, evaluate you and grill you on different things. And so I went through that and obtained board certification there in clinical neuropsychology, and that was a couple years ago now. So that's a little bit about about me and my background. And so then, but also realized, well, yeah, I'm doing my typical day job here at the hospital, seeing patients, but also want an outlet for taking, well, I have all this knowledge and understanding of things that I like to share with people. And so having a Facebook page here where I can share things that I'm thinking about and learning so that other people can benefit from my experience and the things I think about. So check out my page here, and I hope you find it helpful. Thanks.